Hello, welcome to my channel and to another episode of Malezi Friday. My name is Jennifer Munanie and I am the founder of Lea Lactation. In today's episode, I want us to talk all about colostrum. We'll also talk about antenatal colostrum collection. Let's begin with the basics. So what exactly is colostrum? Colostrum is the first breast milk that you make. It's that thick, sticky substance that your breasts produce. It's mostly concentrated yellow in color, but it can be other colors ranging from orange to clear and from thick to watery. Colostrum is your baby's first food and it's so rich in antibodies, especially immunoglobulin A that is useful for fighting infections. It's high in proteins, vitamins, white blood cells, growth factors, and immune boosting factors. Because of its rich components and the concentrated yellow color, colostrum is commonly referred to as the liquid gold. Now, you start producing colostrum during your pregnancy, particularly in the second trimester from week 16 to 20, all the way until a few days after your baby is born. This is possible due to a complex interplay of hormones during pregnancy: progesterone, estrogen, prolactin, and so many other pregnancy hormones. Due to these same hormones required to maintain a pregnancy, particularly high levels of progesterone and estrogen and low levels of prolactin, you produce colostrum in very small amounts during your pregnancy. Some moms may notice their colostrum start to leak towards the end of the second trimester, but most moms do not leak colostrum, and that's normal. Once your baby is born and they feed on colostrum in that first breastfeed, and in the first few days, it coats their gut, establishing their gut flora. This is very important for their immune response and immune protection. Colostrum is also very easy for your baby to digest, and it helps in passing meconium, which is your baby's first stool. This lowers the risk of jaundice. In the first few days after birth, you produce colostrum in very small amounts, but this is enough and perfect for your baby because babies generally take about 5 to 7 ml of breast milk per feed on day 1, 15 to 30 ml per feed on day 2, and up to 60 ml per feed on day 3. Their stomach capacity is very small. Remember how I have mentioned that your body starts producing colostrum during your pregnancy. You can actually collect or harvest your colostrum before your baby is born and feed them after they are born. Now, why exactly would you need to collect or harvest your colostrum during your pregnancy? To practice hand expression, learning how your breast works or responds, and learning hand expression skills is very important. You will need hand expression skills throughout your breastfeeding journey, but especially in those first days after birth. Second, you never know how labor and birth will go. It could be prolonged, there could be complications, or you could be separated from your baby. Having colostrum that you collected during your pregnancy to feed to your baby in case any of these circumstances happen puts your mind at ease. If you are at risk of delayed establishment of breast milk supply, for instance, if you have endocrine complications like polycystic ovarian syndrome or thyroid issues, you can feed the colostrum you collected during your pregnancy to your baby as you work on establishing your breast milk supply. Additionally, if your baby is at risk of hypoglycemia, especially if you are diabetic, your baby experienced intrauterine growth restriction, they are preterm or are macrosomic, the colostrum will come in handy in stabilizing their blood sugars. You can start collecting or harvesting your colostrum during your pregnancy from 37 weeks onwards with clearance from your doctor. Harvesting colostrum during pregnancy involves nipple stimulation, and this may induce labor in some cases. So please always consult your doctor before you can start collecting your colostrum during pregnancy. To collect your colostrum during your pregnancy, you will need sterile colostrum collectors or sterile syringes with a cap and collection cups or medicine cups. Syringes come in different sizes. There is 1 ml, 2.5 ml, 5 ml, 10 ml, and so on. This is a 10 ml syringe. But in the beginning, because you produce very small amounts of colostrum, the 1 ml syringes are adequate. To collect your colostrum, you'll need to hand express. This is the most effective way to do this. To hand express, you'll need to wash your hands and find a comfortable sitting position. You then gently massage all around your breast. You can opt to knead around all the quadrants of your breast. A warm shower before hand expressing can also help with this. You'll then cup your breast in a C hold. Remember not to touch the nipple. We are hand expressing from the breast tissue, not from the nipple. This will cause you pain. This is more comfortable. To find a sweet position on where to hand express, you can place your 2 fingers from your nipple, then C hold from there on. You'll then need to push back your breast towards the chest, compress and release, repeating the motion. Push back, compress, release. Push back, compress, release. Push back, compress, release, avoiding the nipple. In the beginning, you'll only need to hand express for about 5 minutes. Once you've hand expressed your colostrum into your collection cup or into your medicine cup, you can then use your sterile syringe to draw it up. You then label the colostrum with your baby's name, the date of collection, and optionally the time of collection. After labeling, you store your colostrum in the colostrum collectors or in the syringes in a Ziploc bag and freeze it. Frozen colostrum can last up to 6 months. Please note, if you have a history of preterm labor in your previous pregnancy, are at risk of preterm labor in the current pregnancy, or have a cervical stitch in place, antenatal colostrum collection is not recommended for you. Also note that your doctor could have cleared you to collect your colostrum during your pregnancy, but you're not able to harvest any amount. That's okay. You'll still be able to produce colostrum for your baby after they are born, and it's not an indicator of your breast milk supply. I've talked about hand expressing to collect your colostrum during your pregnancy. Now, can you use a breast pump? Ideally, a breast pump is not recommended because there is the risk of inducing labor, and breast pumps increase this risk due to their strong suction. Once you're in labor or you've planned your cesarean section, because a planned C-section or the risk of an emergency C-section is another reason why you should collect your colostrum during your pregnancy, you can then transfer your frozen colostrum from your freezer into a breast milk cooler bag with ice packs to transport it to the hospital or birth center. Once the frozen colostrum has thawed, it's only good for consumption within 24 hours. In some cases, you collect your colostrum during pregnancy, but the challenges you foresaw do not happen, which is great, and you do not end up using the colostrum. What do you do with it? First, it's important that you take small amounts of the colostrum you collected during your pregnancy to the birth center. So a few syringes of the colostrum are enough. The others can be brought to the birth center or the hospital as needed. Second, if you do not use the colostrum at the birth center, you can always use it at home for home remedies for diaper rash, cradle cap, cuts, bruises, ear infections, and so on. Colostrum is really the liquid gold, and if you can, please collect it during your pregnancy. I hope you found this video useful. In case of any questions or comments, please let me know in the comment section below. I'll be sure to respond to them. Thank you for being here. I'll see you in the next episode of Malaysia Friday next week.